I was operated, but until now, no change.
Yes, Naomi. Okay, let's take an. I hope you got what she said. I didn't get some keywords there, but we'll find out more. Hello?
Hello.
Hi, how are you?
Fine.
Okay, state your name, ask your question.
Mr.
Yes?
So my question to the doctor is, what fibroids and operation and medication? What is it is better? And does it have anything to do with family planning? Thank you.
Okay, thank you. Let's take one more call. Hello?
Hello?
Hi, how are you?
I'm fine, thank you.
Okay, state your name, ask your question.
I have this mate of mine.
Yes.
She explained about that he was 6 years, fibroids.
Yes.
And they affect the kid, the baby.
All right, thank you very much. We'll try and answer you there. Okay, let's go back to Miriam's question. She wanted to know what she can do to ensure that her baby, the one that she's carrying, is not affected by the fibroid situation that she has. She lost her first baby, and she wants to ensure that this one is okay.
Okay. Basically, what Miriam needs to do, she needs to start her gynecological visits early. Yeah, she'll need to start seeing her obstetrician quite early. In this way, they can determine where the fibroid is and also anticipate the problems that fibroids can bring when you're pregnant. We had mentioned the malpresentation, which can be anticipated. Other problems that may come are preterm labor. So you find someone going into labor much earlier because generally by the fibroid being there, it occupies space, and that reduces the space that is there in the uterus.
So it can affect the baby
in terms of labor. It can bring labor on much earlier than the expected date.
But isn't it sharing the nutrients inside the uterus with the baby? Okay, now I'm just visualizing my own thing. It's a growth, the babies are growth. It needs some nutrients. I presume it's growing, the fibroid.
But very slowly.
But very slowly,
yes.
That wouldn't affect the baby's growth at all?
No, the fibroid usually has its own blood supply.
Okay.
The baby has a blood supply coming through the umbilical cord, and so in terms of nutrition, growth of the baby, that is not much affected by the presence of the fibroid. Okay. The size, of course, of the fibroid is also a factor. If the fibroid is very, very big, in terms of it appears as a pregnancy by itself, then that is another big problem. Okay. But these things can be anticipated. As long as you start your obstetric visit very early, they know that the location of the fibroid, then we can anticipate the problems that can occur and do something about it.
Okay.
Yes.
Okay. Again, as we talk about pregnancy, we got another caller. She's also saying one of her friends has a fibroid and she's pregnant. What are some of the precautions and effects, I think, which you've talked about? Is there anything else that a pregnant woman needs to know when she has fibroids, of what to do or what not to do to ensure the safe birth of her child?
Well, the good thing about fibroids is that in general they grow very slowly. Okay, so if there is a rapid growing fibroid, then that is a question that we can deal with in terms of what we are going to discuss later. That is something all different that you need to look out for. But generally fibroids grow very slowly. Okay, so in terms of the pregnancy vis-a-vis the fibroid, it is not really a big problem. Okay, in terms of complications, of course, other things that you need to watch out for are things like abruption of the placenta, which just means that the placenta may separate early from the uterine wall, which also becomes an obstetric emergency. So you need to watch out for any kind of pain, any kind of bleeding that may occur during your pregnancy. Don't miss any of your obstetric visits. Make sure you have your ultrasounds done, that kind of follow-up.
Okay.
Yes.
Okay. Let's talk a bit about the other caller who called to find out about family planning methods. Would this be a fast track to getting fibroids? Does this stimulate fibroid growth? That was one of his questions.
Initially, it was thought that contraceptive pills, by virtue of having estrogen, may cause the fibroid to grow, but this now has been found to be not so true. Contraceptives are even one of the ways that you can treat a fibroid medically, in terms of you give a low dose of a contraceptive pill, and this helps to stabilize the bleeding. So you get the symptoms will improve. Although the size of the fibroid may not change because of the contraceptive, they will improve the symptoms. And so contraceptives are now not really known to cause fibroids. Okay, they are actually used to treat the symptoms of fibroids.
Would this be also one hormone treatment? Would that be part of it? Because the family planning methods or contraceptive pill does have a bit of hormone, adding extra hormones into the body. Would this help?
Yes, that is part of it. The hormone treatment that is usually used, you can have the hormone, which is the estrogen, component of the contraceptive pill, which can be used to control the symptoms.
Okay.
Yes.
Okay. Let's talk a bit about what's the largest size of a fibroid? You say that it grows very slowly, but I'm just imagining this tumor going inside you. What in terms of size, what's the biggest like a fibroid can get?
They can grow to weigh several pounds. In terms of size, it can grow to what looks like a full-term pregnancy. Okay, and so you can have the abdomen distending, the uterus distending all the way to what is known as a term pregnancy. So they can be very, very heavy. And
But surely women who are not pregnant, or haven't been trying to conceive a child and notice that there's a growth, wouldn't they like instantly go to the doctor?
Most of them would, okay?
Yeah.
But with the myths that have been surrounding fibroids, oh, I don't want to have my uterus removed, this means I won't be fertile. Those are the problems that hinder people from seeking help when they see something like that. And so you'll see a woman walking around with a very large fibroid because she's still a bit hesitant to have the surgery either done or even to open her mind up to what could be the treatment options.
Okay, we've got to talk about do fibroids lead to cancer? Cancer being a scary disease.
Very, very rarely. Okay. Fibroids are benign, meaning they're not cancerous, okay? But very, very rarely, less than 1% of the time, you can get a fibroid that converts and becomes a cancerous growth, okay? And so that does happen, but is very, very rare. So it shouldn't worry people that now I have a fibroid, I'm going to get cancer. No, that is not something that should be in your mind. The only thing that you need to watch out for, especially in the postmenopausal age group, is if you had a fibroid, which usually shrinks after menopause, but if you get a fibroid that starts growing very rapidly, okay, so you find that the size within a few weeks, you've noticed that the size has